Good afternoon, everyone, and welcome to our college talks, where we're focusing on pathways to MUSC. My name is Walt Tobin, and I serve as the president here at OC Tech, and I'm glad that you've joined us. We think about OC Tech as the first stop on the road to the American dream for many of our students. And so I say the first stop is because we have created opportunities for students to transition directly into the workforce. But there are other opportunities for students to transition beyond the associate's degree and get some advanced training at the baccalaureate level and even beyond. There's no place better to begin your education than OC Tech. And if you're interested in a career in healthcare, there's no better place than OC Tech to begin that academic experience with us. We think about the college in three frames. The first is we think of ourselves as being successful. We provide a high quality academic experience for our students in a nurturing environment. There's significant academic and student support. We have a low faculty student ratio. Many of our graduates in our healthcare programs are placed on the job prior to even finishing their curriculum with us. Our programs are that well known and well recognized. And beyond that, because of the success on our licensure pass rates, our programs in the Nursing and Health Science Division are ranked in the Southeast and certainly within the state of South Carolina. Second, we're flexible. We understand the needs of our students. A lot of our students have families, they need to work, and we take into account the schedules outside of work. And so we build our programs and courses around the needs of our students. We are in the process now for the spring semester of 2023, developing shorter term semesters, 7 weeks, that allows students to focus on 1 or 2 courses at a time and give more time and attention to those courses. And the way that we built that calendar, they can actually complete more courses within a given semester. In addition to that, we provide transfer to all public 4-year and most private 4-year institutions in South Carolina. And that really saves students and parents lots of money. And then lastly, we're affordable. The first 2 years of college, starting with us, even if you transition to a baccalaureate degree, you can save almost $20,000 of tuition. In South Carolina, the average student loan debt is somewhere around $33,000. And so we have the ability to provide an affordable experience for students taught by master's degree faculty. One thing that I will mention is we've been the recipient of several state-funded scholarships and grant programs, and we've been able to offer tuition to many of our students at no cost or at little cost. So this little piggy here shows you the cost savings, but even beyond that, based on what we've been able to provide our students through lottery tuition assistance, the SC Wins grant, and workforce scholarships and grants, these opportunities come to many of our students at no cost. So it's my pleasure to introduce the panel of experts, Dr. Stephanie Brown and Dr. Lauren Geller, to talk about, in particular, the health science pathways that we offer our students. Dr. Brown.
Thank you, Dr. Tobin. My name is Stephanie Brown. I'm Dean of Healthcare Preparation and Workforce here at OC Tech. And I want to give you just a general background about our division and what we have to offer here at OC Tech. So the division, Healthcare Preparation and Workforce, our goals are to provide realistic options with built-in employment opportunities, to grow the healthcare workforce in our community, and also create pathways leading to advanced degrees. Now, we have certificate programs, nursing and healthcare prep and clinical skills, and also university transfer within this division. Under the certificate options, we have CNA, which covers basic nursing care skills. It's 1 semester in length. We also have phlebotomy, which phlebotomy it covers venipunctures, capillary punctures, and that's also 1 semester in length. We have ECG, or electrocardiography technician, where you learn how to do cardiac monitoring. That is also 1 semester. And lastly, our EMT program leads to the EMT basic certification, and that now is only 1 semester in length. So all of these certificate programs lead to employable skills. As you can see, they're really short in duration, and they lead to entry-level positions. Now, I wanted to highlight Ms. Gupta, one of our students here. She was actually a student at University of South Carolina Honors College, and she came to OC Tech to complete her EMT certificate before going off to MUSC for medical school. And she's now in semester 2 of the medical program at MUSC. So this is just one of the ways where you can come in and get employable skills and then use them however it fits your lifestyle and your goals. Now, our prep programs, we have 2. There is the nursing preparation and clinical skills, which is designed for students interested in becoming a registered nurse, a licensed practical nurse, or in transitioning from being an LPN to an RN. And we call our RN program the Associate Degree Nursing Program. We also have the Healthcare Preparation and Clinical Studies program that's designed for students that are interested in radiologic technology, physical therapist assistant, medical assisting, or if you're undecided and you just need to explore healthcare as a whole. This program is designed for those types of students. Our programs that we have here on our campus, we have the Associate Degree Nursing Program, the LPN to ADN Transition or Flex programs. Again, that's designed for an LPN that wants to come back to get their RN. And we also have the Licensed Practical Nursing Diploma Program. Under Health Sciences, we have the Radiologic Technology Program, which covers your x-rays and imaging. We have the Physical Therapist Assistant Program and also the Medical Assisting Program, which is only 3 semesters in length. So those are our programs here at OC Tech. And these are all called competitive programs because there's another application process in order to get into these programs. And once you come in as a prep student, we'll help you and guide you to get you to the level of getting accepted into one of these programs, if that's your goal. Now, our early college program is designed for Orangeburg and Calhoun County High School students. It's a great opportunity for students to earn college credits before you graduate. We do have 2 different types of early college students. We have dual enrollment students who take college credit courses that also count towards high school graduation. And then we have concurrent enrollment students who take college credit courses concurrently to enhance transfer opportunities and career interests. Now, both of these types of students, you have to talk with your school counselor or your principal in order to enroll in classes here at OC Tech. And we're also building our early college staff and faculty here at the college. So there will be a tremendous amount of support available for these students. Now, we also have numerous career pathways in early college. But if you're interested in a career in healthcare, I would suggest either the Associate in Arts or Associate in Science University Transfer or the Nursing and Health Science career pathways. So students that are interested should complete an early college application, have it approved by your school counselor or principal, and then submit that application and any required placement test scores to Ms. Deborah Cooper Davis, who is the Director of Early College. Now, this is a lot of information. All of this information can be found on our website. You just click on admissions, and then under that, you'll see early college, and it'll lead you right to all of this helpful information. We also have the MUSC Transfer option, which is a curriculum designed for transfer into the Bachelor of Science and Healthcare Studies program at the Medical University of South Carolina in Charleston. You would complete the Associate in Science MUSC Transfer here at OC Tech, go on to take the Bachelor's of Science and Healthcare Studies program at MUSC, and from there you can go on to graduate school or you can go on to work. Now that program, it is very robust. It is a 2-year program. In year 1, you would take these general classes that you see here. This is your fall load, then spring, and then summer. Year 2, fall, and then spring, and then at the end of the spring semester in May is when you would graduate. So this is the general track for our MUSC transfer program. Now, under that MUSC transfer hat, we do have different advising models. So if you're asking yourself what happens after you graduate from OC Tech and MUSC, you can use these advising models to help you get to your ultimate goal. And it's going to illustrate the first 2 years completed here at OC Tech, and that's going to satisfy the degree requirements for that associate in science. So I'll back up one slide. This is your general track for MUSC. And if you would like to pursue specific careers, we have different models for you to follow, okay? So for instance, if you're interested in becoming a medical doctor or a dentist, you can follow this advising model. So your year 1, you're taking biology, English, medical terminology, Math 110, Psych 201, which is general psychology. And then you would go on in the spring, finish up biology, the general biology, and your English composition course. You'll start chemistry, continue on with math, and your psychology. Summer classes, anatomy and physiology would begin here with Bio 210. You would take probability and statistics, and you would finish up your general chemistry course with Chem 111. Then in year 2, finish up with your AMP 2, public speaking, Chem 211, which is organic chemistry, Math 140, which is calculus, and then you would take a history class. Spring, micro, Chem 212, your literature course, English 205, and you would start physics in that second spring semester. Your art history and appreciation, and then you would finish up this advising model with ending with physics and then economics. So these 2 years, you could get a good amount of your prerequisites for medicine or dental medicine, and then transfer to MUSC and earn your bachelor's degree. Then after that, apply to medical school or dental school. Now, in any of these advising models that you see, you always want to get the guidance of an advisor to discuss the options to make sure all of your prerequisite courses are complete before you leave us at OC Tech, because we want you to take advantage of the affordability of our courses and also the flexibility of the course formats that we offer. I do want to highlight Chris Foley. He's a previous student here. In our college magazine, he was featured in the summer of 2020. He graduated from our radiologic technology program, went on to MUSC's Bachelor's in Healthcare Studies program. At the time, he was interested in pursuing medical school, but he recently was accepted into MUSC's cardiovascular perfusion program. So all of these different ways you can explore your options and find what's really right for you. Now, pharmacy, we do have a model to get you to pharmacy school. You can see the different courses here. Some of them are really similar if you look at the different advising models. So it does give you the flexibility of changing your mind if you do decide that you want to do something different. Again, always talk with your advisor to discuss any prerequisite courses. Now, I will highlight Miss Taylor Smalls. She is now in pharmacy school at MUSC. She graduated from OC Tech with the Associate in Science MUSC Transfer and went directly into pharmacy school at MUSC. So that's a great option for our students, especially if you're in high school and you know you're going to complete an associate in science while you're in high school. If pharmacy is your goal, we can get you directly into a pharmacy program from right here at OC Tech. The pre-physician assistant model, very similar to what we've seen in the previous two models. One thing that I'll note for physician assistant, if you are interested in becoming a physician assistant, you can also take our EMT courses here. They only last one semester, and that will get you some invaluable experience that will help you prepare for what you'll see in that physician assistant program. Again, talk with your advisor about all prerequisite courses. And then we have what I like to call our therapy and perfusion model. This is if you want to become a physical therapist, occupational therapist, or if you want to pursue cardiovascular perfusion, just like Chris Foley did, or the speech language pathology program, you would follow this model, okay? Now I want to hand it over to Dr. Lauren Geller. She is going to talk with us about that program that I mentioned, the Bachelor in Healthcare Studies program at MUSC, and I will let her take over from here.
Hello, thank you so much for allowing me to join and present here today. And I'm gonna talk about, I apologize for the background noise. I'm going to share my screen here and talk about the second half, which is the Bachelor's in Science and Healthcare Studies program. And as Dr. Gatson-Brown discussed, we're going to talk about the different paths, the pre-health profession models that were discussed. So our bachelor's program, which is online, is what's known as a degree completion program. And so we take students who have completed associate's degrees, so an associate's in applied science, an associate's in science, and associate's in arts, or who have completed at least 72 undergraduate credits in all general education coursework. So even if you have an associate's degree, you still need to have the 72 undergraduate credits, but you don't have to have the associate's degree. We obviously promote it and think that it's a wonderful thing to have. Most of our students do have that associate's degree. So when you meet the requirements, that 72 undergraduate credits in all general education coursework, you're eligible to apply to our bachelor's program. And a lot of our students are really interested in continuing on for graduate degrees. So some of the programs Dr. Gatson-Brown mentioned, like medical school, PA school, PT, dentistry, but we do have a lot of students who are interested in a lot of different areas in healthcare. And so it isn't necessarily limited to just the tracks or models that you might be able to get at OC Tech. It's really, really wide. So again, these tracks or models that have been presented, we are working with the community colleges to set up these tracks. So we work with Orangeburg Technical College and Spartanburg Community College to have these tracks already laid out for you, as Dr. Gatson-Brown mentioned, so that you could come into the community college and know you want to be an MD or a physical therapist. And you take all of the classes that are prereqs for med school or PT school or PA school during your time at OC Tech, and all of the classes that are needed to be eligible for our bachelor's program. So you're ticking off 2 boxes by following these tracks. Now, of course, if you get into these programs and you get through the tracks and you decide you don't want to be a PA, you can still use those credits towards maybe another area in healthcare. So don't think that you're stuck. Like if you get on these tracks, there's not that flexibility. There may be, if you need it, down the line. And that's really, really beneficial because while you're going through the models, you have that flexibility and can be open to other options in the healthcare field. And it's really good to have options available to you while ensuring you're meeting those requirements for the prereqs for the graduate programs you think that you're interested in. This is a picture of our one of our cohorts, and Chris Foley is right there in the middle in the blue. And I show this picture to show everybody that our students are coming from the technical colleges, the community colleges. And so we are a very diverse group. We have a wide range in age from 20 to 65. And students are coming from all over the state, and there several of the community colleges are listed there below. So I point this out because a lot of students, they feel like maybe MUSC is intimidating or just a dream for them. And it's actually can be a reality. And we have all the students and the success stories that I'm going to share with you today to actually show you that this is possible for you. And these programs and models that we've created with OC Tech are really going to help you realize that dream that you have of becoming an MD or becoming a physician assistant. So for our program, the bachelor's program, we help our students in a lot of ways. When you come into our program, if you're accepted, you are an MUSC student, even though it's online. So that's a great piece of it. It creates a lot of flexibility. So if you are working, so let's say you want to be a PA. So one important part of becoming a PA or getting into PA school is having clinical hours. And so our program, finishing your bachelor's, we are very flexible, and I'm going to explain some ways that we're flexible that allow our students to get that extra experience or work experience that they need to become stronger candidates for their graduate programs. That's really important to us. Now, the majority of our students do work full time. So that should sort of be on your radar, that if you have an opportunity to work in the health professions and be getting that experience on your resume, it's really going to help you for your candidacy to graduate school. And so being in an online program offers that flexibility in scheduling. Because you're coming up through the community colleges, as it was mentioned earlier, the tuition is manageable, certainly as you continue on to finish your bachelor's degree, compared to if you started from a traditional 4-year, which has a higher tuition for the entire 4 years or 5, depending on how long it takes you to get through your bachelor's. We have really great faculty to student ratios, so that even though, some people might think it's MUSC and it's a medical school, and our faculty are teaching faculty, and they are very involved in teaching and working with students, and they are available to students. So if a student is struggling, we want to be there to help them. We really want our students to be successful and to get into graduate programs. And so our faculty are very involved in the student process. As I had mentioned earlier, even though it's online, you are an MUSC student and have access to MUSC resources. You guys are not that far away in Orangeburg. And so you would, if you want to drive down to come to campus, the faculty is here. You can meet with your faculty. We do a lot of Zoom meetings, phone calls and things like that. But there is the possibility to come to campus. Obviously, so it's MUSC, we have excellent shadowing and internship opportunities. That might be another reason you might come down to campus. Because of COVID, it's sort of been adjusted a bit, and we're starting to get more back into the normal routine of things. And so that's something we like to help our students find those sites, because again, that's very important to their applications for graduate school. There's opportunities to build network with MUSC faculty, another reason to come down to campus. We've had students do research projects with graduate faculty if you're trying to get into a particular program, there's opportunities to create that relationship, maybe as a research assistant, to get a letter of recommendation for a program you're trying to get accepted into. So there's a handful of things that you might be able to do to again improve your candidacy for the graduate program if that's your ultimate goal. In the bachelor's program, we have between 12 and 13 credits a semester. And so it's between 4 and 5 classes, but 12 to 13 credits. So it's not 15 credits like you will have been taking during your time in OC Tech. And we do that because, again, majority of our students are working full time. They want to get shadowing experience or internship experience or clinical hours. And we feel like that's all an important piece of finishing your bachelor's degree and becoming strong candidates for graduate school. To get accepted into our bachelor's program, we have a preferred minimum GPA of a 3.0. Now, we have a holistic admissions process, which means we do accept students who are under the 3.0 because we look at the bigger picture of the student application. Sometimes we'll have students who come in who are non-traditional students who may have taken classes years ago and didn't do well the first time around. They went back and did better, but their older grades are pulling down their GPA. We take that into consideration. Or if we have students who have been working in the health professions for some time, some of our students have 20 years or 30 years of experience in the health professions, but they have a 2.5 GPA. And so we'll look at their application in a holistic way. However, if you are in a pre-health profession track, so you want to go to med school, PA school, PT school, those programs, they have very standard GPA requirements that you have to meet to even be looked at. And so you should just be aware that if your GPA is below that 3.0, you're going to have a challenge likely to get into any of MUSC's graduate programs, in the clinical graduate programs. And so while you could pull up your GPA during your time in your bachelor's program, some of the clinical programs look at science GPA, which you already would have completed during your time at OC Tech. So you couldn't actually improve that during your time with your bachelor's program. So keep that in mind. If you have a goal to go to a clinical graduate program, you really want to keep your GPA high. We require statistics, 2 letters of recommendation, a personal statement, and a resume will go into our application. And again, while it's not required, strong candidates do have an associate's degree. And we do have a lot of students who come in with the AAS degree. So as was discussed in the beginning of Dr. Gadsden-Brown's presentation, occupational therapy assistants who want to be OTs, physical therapy assistants who want to be PTs. Chris Foley was a rad tech. He finished his bachelor's degree and then moved into cardiovascular perfusion. So we have the capability with this partnership between Orangeburg and MUSC to really tailor, sort of what you as a student are interested in, or if you're a counselor, what your students might be interested in, where you could even get an applied associate's degree, get out in the field, get some job experience, and then go back to finish your bachelor's degree and then move on to graduate school. So there's a lot of really interesting combinations. It's really, really open to what your passion is. And I think, so speaking with Dr. Gadsden-Brown about what that might look like, and then eventually us at MUSC, we love advising students and helping them find the path that they feel is right. And we understand that you may find what you think is right and then change your mind and then get really passionate about one process and then change your mind again and then change your mind again, and that's okay. Finding your way takes time. It's never a straight line. There's a lot of curves, and we understand that. I just wanted to give you an overview of the classes that are required in our program so that you understand what the bachelor's degree is. Because, if you have a desire to go to PA school or med school, you've taken your science classes at Orangeburg and your gen ed classes. Our bachelor's program is not like biology or chemistry, which most people think when they go to get pre-med degrees, what they're getting their final classes in for their bachelor's. Our classes are a very broad overview of the healthcare system. And so we're really wanting students to understand the bigger picture of healthcare. And a lot of the content that you will learn during your time in the bachelor's program is really going to help you understand your clinical practice, if that's the route you're going to go. We also have non-clinical paths. Students can do that as well. So it's doesn't have to just be clinical, but if you are clinical, evidence-based practice and research is something that's very prominent, threaded throughout our curriculum, that we really teach students so that they understand their clinical profession and patient care in a much deeper way. One really great aspect of our program is that students have the ability to target their educational experience based on their passions and their career path. So if you want to be a physical therapist, all of the assignments that you have flexibility in picking topics. When you have flexibility in picking topics, you can pick a physical therapy topic. And so you're really sort of diving deeper into physical therapy. But if you are a dental hygienist who, maybe wants to go to dental school, and you can investigate dental health throughout all these, as you see the courses listed here, rural dental health and health behavior, dental health behavior and education. So why don't people floss? We know we should floss. Why don't people floss? So you might learn about that health behavior models that really explain, the idea of behavior related to dental health. I'm just giving you as an example. Now, we talked about the pre-health profession tracks, and those are for students who are interested in going to different graduate programs, but you don't have to go to graduate school when you graduate with our bachelor's degree. You can just get your bachelor's degree and go out and work in the field as a community health worker, a health coach, a worksite wellness coordinator. Patient navigator is really big now. So if you were, for example, a surgical tech, and you finished your bachelor's degree and you wanted to move out of clinical space, patient navigation is a great opportunity because we need patient navigators to help patients get through the healthcare system. And as a surgical tech, you have an understanding of the clinical side that's really helpful for helping patients move forward. So these are some of the graduate programs, and we've talked about them in the pre-health tracks, but there's a few others here that haven't been mentioned. And so I wanted you to see this just to understand that there's so many opportunities and exciting programs, and you don't have to be tied down to one thing. If you start in a program and you decide you want to investigate another option, there's just so much there. So public health, we have a student who's in a biomedical ethics degree. And even if you want to go to law school, health law is a concentration, and it's a really interesting field. So our faculty in the bachelor's program really work with students to think about what it is they want to do and what passions they have, and talk about different career paths that they may be interested in. So I wanted to just sort of highlight some of the paths that our students have taken. We really work with students to sort of push themselves outside their comfort zone and apply to programs that are really exciting to them. You don't just have to go to MUSC graduate school. If you join our bachelor's program, we'd love for you to do that, but we want you to find the right fit for you. So if you come in, finish it at Orangeburg, and then finish the bachelor's degree and have an interest in a program that is, maybe MUSC doesn't have that program, like biomedical ethics, we don't have that program, or you are shooting for an Ivy League school, again, we work with our students to sort of talk that through and think about all the avenues that may be of interest to them. So I put this slide up to show you that, again, we have students coming in from the community and colleges who are finishing our bachelor's degree and then going off into unbelievable graduate programs, really life-changing opportunities. And these students that I have listed here, this is not like they came in and they had a 4.0. These are sort of regular students who, we worked with them. A lot of them did have work experience on their resumes. So that is one factor. But we have students coming in from all the technical colleges, finishing their bachelor's degree and going on to Columbia University, and Johns Hopkins School of Public Health is the #1 school of public health in the country. We have a executive master's in healthcare administration at MUSC. That's an online program. We even had a student go to George Washington University Medical School for a master's in laboratory sciences. So if you're an MLT, there's another path. We have a lot of military students. And so we had a student go into the military inter-service PA program. So, again, I put this up for you to see that we have a lot of options. One other thing I didn't mention, as not having a lot of non-traditional students, we also get a lot of students who have families. We've had a handful of, probably more than a handful of babies born to students during their time with us. And, as a program, we're sort of understanding some of those things that occur in sort of the real life with students. And we take that into consideration, how we work with our students. So thank you very much. My information, my phone number, my email address is here. We have several really great videos on our website, testimonials from our students that can really answer a lot of questions and really get to that student perspective that I think helps potential students find out more about our program. Thank you. I think you're muted.
Thank you, Dr. Geller, and I will share my screen here so we can close out the session. If there are any questions, if you could place those in the chat. I want you to write down our email address, healthcare@octech.edu or admissions@octech.edu. You can also email askme@octech.edu and we will get those answers out to you. It doesn't look like we have any questions in the chat, so I will close out our session. Thank you so much for joining us today. We hope that you learned something about our programs that we have here at OC Tech and MUSC. And again, you have all of our contact information. Do not hesitate to reach out. Thank you so much for joining us.